Let's go. Posture number 1, are you ready? Okay. Right, today we're going to talk about what we call Lordotic posture or S-shaped posture. What is S-shaped posture? If you look from the side, you can see that she has a little bit of a S-shaped posture. So this is like an S. Why is this posture not good for you or gives you low back pain? The reason for that is because in this S-shaped posture, you can see that your back is big and compressed. Now, what is a normal posture? A neutral posture, a more neutral posture is this posture. So you're comparing this posture to this posture, which is the S-shaped posture. You can see that the lower back gets compressed. The people out there think that this is the ideal posture. Okay? Why do they think that? They think that because the media projects it as so. So the models have this sort of posture, and women tend to wear high heels to try and have this posture. But in effect, it's actually really bad for your back, as you can see. Now, there are two sorts of people. People with their center of gravity forward. So you can imagine the pregnant ladies. If the lady is pregnant, the center of gravity is actually forward. Now, then to kind of counter that center of gravity, the preggy has to lean backwards. When they lean backwards, similarly, they increase that compression and they create this hollowing the back or the S-shaped posture. Another group of people who aren't big can also have this posture. So people who are slim, people who are not fit, people who have tummy muscles that are actually quite weak. When you're in a neutral posture, like this, you actually require your tummy muscle to be fairly strong to hold you in that position. When your tummy muscle in the front here, especially in the lower part of the tummy muscles, are weak, what happens is that your pelvis tilts forward into a more arched position, and that's how you land in a lordotic posture or a S-shaped posture. So, what are some of the aggravating factors for this sort of people? These people with lordotic back or very arched back will not like activities that encourages even more extension or arching. For example, breaststroke, backstroke, and butterfly all encourage even more arching of the lower back. So they shouldn't do that. If they do swimming with this sort of strokes, they're going to end up with more back pain. What other activities? Anything that requires arching, like cobra, for example, in yoga. So you don't want to be doing cobra. The more you do cobra, the more arching there's more compression. How about standing for a long time, walking for a long time, prolonged walking, running? Okay, the first exercise for S-shaped posture or lordotic posture is the child's pose position. Why do we need to do the child's pose position? So if you remember the lordotic posture, the S-shaped posture, the back is really hollowed. What we want to do is actually stretch out that lower back. To do that, all we want to get her to do is actually sit back onto your heel and stretch out this way. So as she does that, she opens up her back, and that's going to ease a lot of that tightness. From this position, what we can do, if it's only one-sided pain, so say for example, it's only a left-sided pain, then we know the left-sided muscles are a lot tighter. We can bias this exercise by getting her to walk her hands towards the right. So walk both hands to the right for me, Jess, and hold that stretch. So you can see from this position, not only you're opening up the back into a more flexed position or more rounded position, you're also specifically biasing it to the left side so that you're stretching the left side a lot more. You can hold it there for 10 counts, and then you can come back and repeat. Okay, so the second exercise is what we call the backward pelvic rock. What's the goal of this exercise? Twofold. The first reason why we're doing this is to strengthen the tummy muscle here, the lower abdominals. If you remember, we talked about the lower abdominals, the lower part of the abdominal muscle being weak, right? And that's why your pelvis tilts this way. The second reason why we're doing this is actually retrain the ability of the brain to tell the muscles to activate into this position. It also stretches out the lower back. So what we're going to do is going to get her to, as she lies like that, think about her tailbone. What I want her to do is actually just take her tailbone away from the floor and then putting it back down. Now when you're doing this exercise, you want to be mindful that you're using your tummy muscle here rather than pushing through your legs. Jess, can you push through your legs first? So you can push through your legs to create the same movement, but that's not what we want. So we don't want you to cheat by using the legs, because remember, one of the objective here is actually to build your abdominal muscles in front. So you're going to try and think about a string tied to your tailbone, and you're going to draw it up, pull your pelvis up towards yourself, and then putting it back down. Okay? And again, so Jess will do that. And down without using your hammies, keeping it soft, just really using the abdominals. So in this position, she's strengthening her tummy, and she's stretching out her lower back as well, and that's what you need. Third exercise is the hip flexor stretch. So if you remember the S-shaped posture has the pelvis tilting forwards this way. And the reason why it's tilting forward this way is because your hip flexors get very tight in this position. So unless we stretch that out, we never get out of the S-shaped posture. Now to stretch your hip flexors, get into this position, half kneeling position, make sure your pelvis is level facing forwards. You're going to tuck your tailbone in first as a start. The reason why we're doing that is because I don't want her to go into an arch posture. So that's just going to compress her back and it's going to give her back pain. From this pelvic tilt position, you're going to lean forwards until you feel a slight stretch in the front here. Now because the hip flexors attaches to the spine, we're stretching the right side, attaches to the right side of the spine, we're going to add the arm up this way and get her to side bend this way to be a bit more specific in the stretch. And where you should feel it is right in front through here. Hold that position. You're going to take a big breath in, big breath out. You're going to lean forward slightly more and you're going to side bend a little bit more. Big breath in and out, come forwards a little bit more and side bend a little bit more. You can feel the stretch through there.